Okay, unfortunately, it seems like my video still cannot be turned back on.
All right,
But
CTBers, we're going to kick off Global Finals with our first official event, our hackathon. So through our hackathon, you guys will be presented with a real-world case study and given 50 hours to propose a solution. The hackathon will require all the skills you've learned over the course of your CTB journey: teamwork, collaboration, research, and innovation.
For this year's theme is going to be prepare your community for the next epidemic. And 5 years ago, Bill Gates gave a famous talk warning the world that we are not ready for the next outbreak. 5 years later, COVID hit, and he was right. We were not ready. Since December 31st, 2019, over 28,802,775 cases of COVID-19 have been reported globally, including 920,931 deaths. Countless have been left without access to basic testing, healthcare, PPE, and food security. So what can we do better next time?
We have several tasks outlined for you in order to tackle this problem. The first of which being identifying a problem at hand. So reflect on the beginning of the year and how your own community responded to the pandemic. It's really important to identify one aspect of the emergency response that you think could have been improved or further developed.
Our second task is to conduct research. You should briefly describe what you have found in the current situation to be problematic or inefficient. And in your research, please use numbers, and please use numbers in your presentation.
Our third task is then to find a solution. So once you have your problem identified and you've done your proper research, next step is to come up with a plan that can be executed. So for the next epidemic, we can be ready. This plan should be as specific as possible. To help us understand what you have in mind, feel free to come up with a demo, whether it be a flow chart, a prototype, or even just a couple of drawings.
And we also want you guys to test the solution in your community. So go out into the streets with your demo, get feedback from real people from your community. Do they believe in your plans? Will they be willing to cooperate? Include their suggestions into your report.
Our final task for you is then to take everything that you've done and put it into writing. So once the solution has finalized, lay out a 5-year plan on how it should be executed. So we're asking from you to deliver 2 deliverables, first of which being an abstract. And so go ahead and describe the problem that you've identified, what went wrong, and how you plan to improve in the future. We've got a 500-word limit. It's meant to be something that's really short and just a big summary of your entire solution. The next deliverable we'll ask of you is to deliver slides. So you'll need to write a full report using slides to showcase your work. The same slides will be used for the hackathon showcase if you are selected as the top 30% of teams who advance to the next section. No animations are needed. You can insert graphs, pictures in the slides, but no videos or external links are allowed. As for format, please go ahead and save these slides as a PDF file, and our slide limit is 20 slides. So any additional slides further than 20 will not be viewed by the judges.
Here is an outline of the structure of your slides. So the first and second slide should provide some background information. Describe your community to us and how your community responded to COVID-19. In the third to fifth slide, you should identify the problem. So what's wrong with these responses? What was not good enough, and how did you realize it? The sixth to eighth slide should show that you understand the cause of the problem. So why did this happen, and what's the deeper or systematic reason? And then the 9th to 11th slide should provide a solution. So what is your plan if you were in charge? And you should describe an ideal picture. Show a demo if you have one. In the 12th to 14th slide, get quick feedback. So how are people in your community responding to your plan when you talk to them? What have you learned from them? In the 15th to 17th slide, finalize your plan. How do you plan to carry it out in 5 years? And then in the 18th to 19th slide, show collaboration. Who did what during the hackathon? And slide 20 should give the references of all the sources you used. Again, this is just a suggested structure. You may use up to 20 slides, but no more.
As we mentioned a little bit earlier, for our hackathon competition, you've got 50 hours to propose a solution, and that 50-hour time starts now. And so we ask that you deliver your deliverables by October 6th, 2020 at 10 p.m. China time. Our showcase selection, those who will advance to the next round, the 30%, will be announced at midnight China time. And our showcase, our hackathon showcase, where you will be presenting your projects to a panel of judges, will begin at 8 a.m. the very next day on October 7th.
So how will the judges be grading your hackathon report and slides? They're looking for if the problem is specifically identified, if the problem is important and worth working on. Second point is if your research is intensive and does it reveal something that we don't already know? And is your solution creative? Are you good at problem solving? Is this solution feasible? And then do you know, or what have you learned from the feedbacks you are getting? Is the report well written? And does your 5-year plan make sense?
A couple of final tips that we have for you before you embark on this journey. Pick only one aspect to work on. This prompt is really, really broad. There are a lot of different types of projects and aspects of the epidemic that you can choose to focus on. So it's impossible to encompass that all into a 20-slide presentation. And so we ask that you focus on one specific aspect of the pandemic. A couple of ideas that we've laid out for you, you'll also find it in your prompt packet, are that you can come up with alert systems that can detect epidemics earlier, health systems that can mobilize hospital and healthcare workers, improved insurance solutions, technological innovations that help with the well-being of the general population, faster vaccine development processes, or any other types of solutions. Second tip is to make sure you spend enough time to work on the deliverables themselves, especially the abstract. Remember that these 2 deliverables are what is going to kind of summarize all of your work. And so you want to make sure that these deliverables, encompass all the work, the hard work that you put into the hackathon over the past 50 hours. Our third tip, again, is just to be creative. There's no answer that is too wild or too crazy. And so as long as you back it up with good research and evidence, you can really talk about anything. Our very last tip is to be sure that you're not submitting everything last minute. Just by the nature of online portals, we might experience some technical difficulties, or you might experience technical difficulties when submitting your materials. So make sure you're submitting everything in a timely manner. And with that, we wish you the best of luck with this hackathon. It's going to be a lot of fun. And so be forth and be creative.
Good luck.
Good luck.
There you go. That is your first mystery solved for the evening. We have another important event that might just help you prepare for the hackathon. At CTB Global Finals, we have a long tradition to bring some of the leading scholars to speak to our participants. This year, we are very honored to have Professor Rifat Atun from the Harvard School of Public Health to join us today. Professor Rifat Atun is the Professor of Global Health Systems at Harvard University and the Faculty Chair for the Harvard Ministerial Leadership Program and the Director of Global Health Systems Cluster at Harvard T.H. Chan School of Public Health. His research focuses on the design and implementation of health system reforms and their impact on outcomes. His research also explores the adoption and diffusion of innovation in health systems and innovative financing in global health organizations. In addition to all this, Professor Toon has worked with more than 30 federal governments all around the world, as well as the World Bank, the World Health Organization, and the UK Department for International Development to design, implement, and evaluate initiatives to reform their health systems. Without further ado, please join me in extending the warmest of welcomes to Professor Rifat Atoon. Thank you, Professor. The floor is yours.
Yes. Thank you, Marco, and big congratulations to China Thinks Big for this incredible event. I wish all the participants great success in their innovations and endeavors. Very, very important. We collectively need to work together to solve the COVID-19 problem. So I'm going to speak for about 20 minutes and leave 10 minutes for questions and answers at the end. And my presentation is going to focus on health systems and the COVID response, in particular why it has been so challenging for health systems to respond to the COVID-19 pandemic. And then try and leave you with some thinking at the end to consider how to incorporate systems thinking into your innovations to ensure that they're taken up and they're scaled up in health systems to have impact on the COVID-19 response, as well as improving outcomes for healthcare in China. So very important to understand up front, and you may wish to indicate this in your introduction to your innovation, that health and health systems are critically important for generation of wealth, for social cohesion, and for security. Good health leads to less illness and reduces premature death. It leads to healthier populations and more human capital. It helps to improve productivity and reduces absenteeism from work, which collectively help to improve economic growth and contribute to sustainable development. So your innovations will contribute not just to healthcare or the health system, but to broader wealth and well-being of your society. And what we have seen COVID-19 is the exact reverse of that. We've seen that the pandemic has had a huge impact, not just on the health of individuals and the communities and the populations it has affected, but also we're seeing huge economic and social consequences with terrible adverse impact. And what we are seeing is that the COVID-19 has been the great inequalizer, both within and across countries. And today we have the statistics of 35 million reported cases and more than 1 million deaths. But of course, these are real underestimates. The numbers are far higher than what is reported by countries and by international and other agencies. But what COVID-19 has done is it has really laid bare the stark inequities that exist. It has really unmasked these inequalities, but also compounded the inequalities that exist in countries. And what we're seeing even in the richest countries is that the most vulnerable populations in the greatest need have been the ones who have been most adversely affected by COVID-19 pandemic, namely the poor, the elderly, the women, and those living in underprivileged parts of the country, especially in rural areas where it has been difficult to provide access to services. And the economic impact has been huge. So in April 2020, the International Monetary Fund projected that the global economy would shrink by 3% and 6% decline in advanced economies and 1% in emerging markets. But by June, these projections were revised with the projections of global economy declining by almost 5% in 2020, 8% in advanced economies and 3% in emerging markets and developing economies. I'm sure the next revisions will give similar, if not worse, figures. And I'm not optimistic that we're going to see a rapid rebound in all economies in terms of economic growth. But the consequences of COVID-19 have been huge on health, economy, and security of countries. So we're seeing increased unemployment, rising poverty, challenges to food security, but we're also seeing the breaking or the undermining of the social compact, especially changing social attitudes to science, with social polarizations in those who believe in the science and those who question the value of science and what science brings to policymaking. And this is quite dangerous. And we're seeing in many settings how science has not been used to guide policies in relation to COVID-19 response, with terrible consequences for individuals, communities, and populations. And of course, COVID-19 is not just an issue for a country. We're highly dependent on one another. So this interdependence and interconnectedness is critically important. So the response has to be holistic and global, because the response is as strong as the weakest link in the chain. But what has been the response? And of course, the response has been varied in many countries. And some countries have done very well, others not so. It's very interesting that many countries in Southeast Asia and the Pacific have done quite well in relation to COVID-19 pandemic, but many countries in Europe and the United States and Latin American countries have really struggled in their response. And we can analyze the response by looking at health systems. This is a framework I've been using over the years to analyze health systems. So essentially, we think of health systems having a number of critical functions. For example, the way we govern and we organize health systems, the way systems are financed, and the way the resources in health systems are managed to produce health system outputs in terms of public health services, but also healthcare services for individuals. And then important decision policymakers need to make in relation to these health system outputs is that they need to ensure that they're effective, they're efficient, they're equitable, and they're responsive to needs of the users. And the balance of these objectives will vary from country to country, but these outputs are used in turn to produce health system outcomes, namely improving health, improving financial protection, and improving user satisfaction in those who use these services. And we're interested in not just improving the average level of health for the population, we're interested in everyone benefiting. So we're interested in equitable outcomes in relation to health and also financial protection, which means that when individuals are unwell, they're able to access services without having to worry about out-of-pocket expenditures that might push them into poverty, especially when these out-of-pocket expenditures are high. So how have the systems responded to COVID-19? On the whole, looking at the numbers, we're now 6 months or so into the 7 months into the epidemic. On the whole, the responses have been fairly ineffective, fairly inefficient, inadequate in many cases, and in others, inflexible. As a result, we have terrible human consequences of COVID-19. But we knew that the health systems were long in decline. What COVID-19 has done is really unmasked the sheer magnitude of this underperformance. This is a study we published last year in The Lancet, where we analyzed in 44 low and middle income countries using data for more than 1 million individuals, individual level data with biomarkers to analyze how high blood pressure, which is the commonest chronic disease, is managed in different parts of the world. We analyze the response by region of the world, but also by country. But I present here response by region. And what this figure shows is that what we call cascade of care. So how for every 100 individuals diagnosed that has hypertension, what proportion has their blood pressure measured, what proportion are diagnosed, what proportion are treated, and what proportion have their blood pressure controlled. And what we see in this analysis, in this figure, is that in Latin America and the Caribbean, for every 100 individuals that has high blood pressure, around 80% have 90% have their blood pressure measured, but only less than 60% are diagnosed. Around 50% are treated, but only 25% are controlled. But in other regions of the world, the performance is much worse. For example, in Middle East and Central Asia, for every 100 individuals, again, around 90% have their blood pressure measured, but only 50% are diagnosed, around 40% or so are put on treatment, but under 20% are controlled. The figures get worse for Southeast Asia, where only 60% of those with blood pressure have their blood pressure ever measured, less than 40% are diagnosed, around 30% are put on treatment, but less than 10% actually have their blood pressure controlled. Sub-Saharan Africa is similar to Southeast Asia, but figures are actually much worse, with, again, less than 10% having their blood pressure controlled. So this is the commonest chronic disease. And measuring blood pressure is not complicated. Treatments are available. They're not complex. Yet, we are missing so many people with blood pressure, and we're not putting them on treatment. And even those who are put on treatment, not everyone is benefiting. So there is real underperformance in health systems in relation to managing common conditions. So when COVID-19 came, systems were not able to diagnose individuals with COVID-19, and many parts of the system broke down. They just could not augment capacity, manage supply chain management, provide personal protective equipment, or effectively manage these individuals when they were admitted to hospital. So in your innovations, do think, how is my innovation going to help the health system to improve outcomes in relation to COVID-19 in the community or in the general population? Because without a well-functioning health system, we're just not going to get the outcomes. But why have health systems responded so poorly? Why have the response been so underwhelming in so many settings? Well, in an op-ed a couple of years ago, I argued in the Financial Times that we have a misalignment of innovations. Whereas scientific developments have led to unprecedented delivery of innovations of medical devices, new medicines, and health technologies, innovation in delivery of these into health systems to reach people has faltered. So whereas in terms of delivery of innovations, we have quite a renaissance in terms of the science. So we have lab on a chip, we have big data and analytics, we're transitioning towards population level healthcare to precision health. Whereas on the delivery side, not much has changed. This is Hôtel Dieu de Paris, which is the oldest hospital in the world that is currently functioning as a hospital. It was built in the 7th century, 651 to be exact. So 13 centuries later, still functioning as a hospital. So when I say that in the delivery side, things have not changed very much, I'm not exaggerating. So we have a real challenge. On the one hand, we have incredible innovations being developed, but on the delivery side, these innovations are going into systems that have not changed very much for centuries. And again, if we look at the interventions used to manage SARS coronavirus 2, many of these date back to medieval times. For example, quarantine, 40-day isolation. This goes back to Venice, Silk Road, 14th century. Hand washing, social distancing, and face masks. Again, many of these interventions have been used for centuries. So there's not been dramatic improvements in relation to delivery. Of course, we have new technologies in relation to testing, new diagnostics. We have new medicines to help reduce the replication of the virus. We have many vaccine candidates, hundreds in fact, that are going into trial to produce a vaccine against COVID-19. But the challenge has been the delivery side. We've not really improved very much. So why is that? Well, we need to completely change the way we think in terms of where we innovate and how we innovate if we are to address this innovation misalignment. Because insanity, as Einstein said, is doing the same thing over and over again, but expecting different results. So by pushing more innovations into a broken delivery system, broken health system, is not going to get the outcomes that we want. But we cannot solve our problems with the same thinking we used when we created them. So we need to completely rethink in terms of our innovations, what to produce, what to develop. And these innovations should focus not just on the technology, but the way they're going to be used to transform health systems and healthcare delivery to help to have the desired outcomes. So there's a great opportunity. If you look at which health systems have performed well in relation to the health system functions, those countries that have strong leadership, good command chain, agility in the way the policies were developed and changed, reliable communication, consistent communication, and use of science did well. So this is the governance function of health systems. In relation to financing, countries that had good budget flexibility and were able to shift funds from one area to another area, again, did better compared to others in relation to COVID-19 response. In terms of resource management, countries that develop partnerships, put in place supply chain systems, were able to use the available production capacity in the country and flexible use of resources, both trained health personnel, but also citizens in the COVID response, again, were able to mount better response. In relation to public health, the countries that have done well were those who were able to develop testing capacity, but very importantly, capacity for tracking and tracing individuals with COVID-19 infections and those who came into contact with them to ensure rapid isolation and quarantine. And countries have used data and analytics, especially with geographic information systems, to better understand where the epidemic was, how the epidemic was evolving and where in the country to develop a targeted response. And in relation to healthcare services, countries that have used technology-enabled care delivery solutions and used both the public and private sector capacity and innovated in their approaches have done better. So as a response, in relation to the outcomes, we see different responses. Some have seen sort of a J-shaped response, where the response has been initially slow, but then developed very well. Then in some countries, we are seeing a V-shaped response with a sharp decline in worsening of outcomes, but a rapid improvement. In others, we are seeing a lingering underperformance with a U-shaped response with a very wide U. And in others, we are seeing a W-shaped response with good response to first wave, but now now a response being developing to a second wave. So how do we move forward? Well, innovation is critical, and this is what you're doing as part of this initiative to develop better and stronger health systems. So we need innovation to ensure we develop agile systems that are responsive, but systems that are also resilient, that are going to withstand pressure over time. And this is critically important, not just for health systems, but also for our economies, for social cohesion, and for security, for our countries, but the world as a whole. So when you're thinking about your innovations, think to ensure that they're effective, they're going to be efficient, they're going to improve efficiency, they're going to improve equity, and they're going to improve responsiveness to generate more value for money, but also value for many, so that everyone in the population benefits. And for that, think to harness innovations and to transform health systems, we need people like yourselves, but we also need partnerships at every level. We need platforms, existing ones and new ones, but we also need policies. So think how your innovation is going to be taken up and what the policy constraints are, because without policy change, these innovations will not be introduced or scaled up in the health systems that you're working with. So thank you very much for your attention. And I'm going to stop here and have a few minutes for questions and answers. Over to you, Marco.
Thank you so much for that very, very insightful presentation. I certainly got a lot of value out of it, and I'm sure that our participants did as well. I think we'll kick it off with one question that we got from I believe his name is Oliver or Guan Alwen, and he asks how you think the politicization of the coronavirus has negatively impacted the global response to the pandemic. And I'm like, just to kind of build upon that question, if you have any thoughts for how maybe the process could have been made more efficiently or implemented, or gone about, the implementation had gone about more efficiently.
Yeah, this is an excellent question. So the first challenge is communication. The communication in relation to policies and interventions have not been consistent. And they've also not been very clear, even for those of us who work in developing policy responses to COVID-19. In many countries, the responses have been very confusing. So for the general public, it's very difficult for them to really understand how they should change behavior. But even the global policy recommendations, such as use of face masks, in the early days, the WHO recommendation was that face masks were not necessary, but later on, we were told that it is necessary. So this has caused huge confusion. And we're seeing in some countries, leaders and populations are using face masks, in others they're not. As I said earlier, the response is as strong as the weakest link, because humans are the vectors for the transmission. If everyone is not adhering to appropriate behavior, then the epidemic is going to continue to expand and worsen.
Yeah, that makes a lot of sense. I guess in terms of kind of building upon that as we wait for the questions to come in, I'm curious what your thoughts are in terms of, so you talk about that, the issue being this lack of consistency. And when the students are thinking about their own projects and the way that they're going to go about tackling the hackathon, what would you recommend? Would you recommend, like, in their approach, to start out a little bit inconsistent and then design in such a way that their actual solution, their proposal, is consistent? Or would you say that they should always be thinking in a very consistent manner, in a very structured, consistent manner? Like, I guess what I'm asking, do you go more for breadth initially or depth?
I would go for depth. I think it's very important to identify a very specific problem that needs solving. And that problem needs to be very well defined. And then one has to think in terms of the innovation, how this innovation is going to help solve that problem, but what the benefits are going to be. As I said earlier, very important to think how the innovation is going to contribute to the effectiveness of the services delivered, efficiency of the services delivered, equity of the services delivered, or the responsiveness of these services to individuals. So one needs to demonstrate value for money, so that there is health and economic benefits, but also value for many, so that a large number of people in the population benefit. So think not just about the technology, but what the benefits are going to be of the innovation that you're producing or you're proposing.
Gotcha. Yeah, I think that makes a lot of sense. We got a question that kind of relates to this. Unfortunately, my Chinese is not good enough to be able to read the name of this participant. But they're curious, like, how would you go about defining response, right? So is it like, I guess to tail the question a little bit, I guess any sort of solution, any sort of idea, recommendation out there would be in response to the challenge pros, in this case, the pandemic. But how would you specifically define the word response? I guess used specifically for like actionable, in an actionable sense.
Yes. So the response is very broad, and I tend to think in terms of health system functions. So if we go back to our framework here, so is the innovation going to improve the organization and governance of the health system? For example, by making available means of better communicating policies? Or is it going to modify financing? Or is it going to modify the way resources are managed? For example, improving management of supply chain, or developing a solution for resource optimization to see how health workers in different parts of the country are used and whether the resources are aligned with the current need, or show how the innovation is going to improve the delivery or design of public health services or individual healthcare services. So be very precise with your innovation to show which part of the health system is going to impact, whether it's going to impact on one of the functions, but very importantly, how is it going to help improve the outputs in terms of their effectiveness, efficiency, effectiveness, and responsiveness, and how, in turn, this is going to help us achieve health system outcomes in relation to better health, financial protection, or greater user satisfaction, or all of the three.
Thank you, Professor. Yeah, that makes a lot of sense. And participants, I really hope you're taking notes here. I think this is some very useful stuff for your hackathon presentations. So be specific and narrow in your thinking to be able to make sure that you're actually making some sort of impact in your recommendation. Yes. Professor Toon, we'll take one final question from the students. And this one comes from Siho Moon. So she notes, she notes that you say that innovations are needed both in technology and delivery to sustain the health system. And the participant is wondering if you would consider the reprogramming the managing system of a certain part in the health system, whether you would consider that to be innovation, and if you can kind of detail your thoughts a little bit on that.
Absolutely. In fact, one of the points I tried to show you was that in many countries that where there was no shortage of money or even the availability of diagnostic kits, it has been very difficult to put in place testing, tracking, and tracing systems. One reason was because the organization failed. They just could not organize the distribution of the testing laboratories, or the supply chain management failed. The diagnostic kits could not get to the parts of the country in time when they were needed. Or the technology failed in relation to presenting the results back to individuals or analyzing them in an efficient and timely manner to show what was happening, or the tracing systems failed completely. So you can have the best technology, but if the system is not working, this is just not going to have the impact. So an innovation that improves the organization of the system, better use of the resources, supply chain management, resource optimization, these are critically important because delivery is where the big gains are going to be. And technology should be used to enhance delivery and health systems generally.
For sure. Participants, again, hope you're taking some good notes. Your solution, your recommendations won't mean much if it means that it doesn't necessarily mean that delivery can actually happen. This is some really good stuff.
Marco, I want to stress this point. That's a critically important point. Innovation implies use. It's different to invention. You can invent a great technology, but if it's not used, that's not innovation. And for it to be used, the delivery system or the health system needs to function.
Yep. Again, participants, innovation implies use. I'm quoting Professor Toon. I hope that that this citation, so to speak, is sufficient enough. With that, I think we'll end the Q&A session for now. Thank you to all the participants for sending in your great questions, and thank you once again to Professor Toon for spending a little bit of time with us here at CTB Global Finals. I'm sure the participants found it really, really helpful. I certainly did as well. So this is some really great stuff. Thank you again, Professor Toon.
Thank you, and good luck to everyone. Enjoy the hackathon.
Thank you.
Bye.
With that, everyone, this is almost the end of today's opening ceremony. Just two more announcements that I'd like to take the opportunity to make here. First off, starting tomorrow, each team will have lots of fun and challenging events awaiting for you guys. Let me emphasize one more time that you should always be checking the website for the correct time and Zoom link for each event. The first step to success is to actually be there on time. And secondly, if you cannot make it to your clinic session, please, please, please make sure to request a leave of absence via email. Please respect the mentors who take the time out of their busy lives and schedules to help you. A no-show would be rather impolite and may affect your CTB scores. So no one wants that to happen. So please, if you cannot make it, please make sure to request a leave of absence just so we're aware and we can speak to the mentors who have kindly agreed to spend a portion of their time with you all. With that said, I'd like to take this opportunity to stress one more time what Professor Toon said in his session. Please make sure that when considering your hackathon's proposals, to not only focus on what seems creative, what seems really cool, but make sure that it's actually feasible. Make sure that it's actually usable, because none of that, as he said, innovation implies use. And I think that was probably a very succinct and also great way to frame his whole session, right? Around thinking about different solutions, thinking about different ways to go about solving the problem, while also making sure that it is actually usable. With that said, I will be signing off here, but we all wish you good luck in the Global Finals competition. Ultimately, this is more than a competition, though. This is about you guys enjoying yourselves and having fun with all that CTB has hopefully been able to offer you. And this is just an opportunity for you guys to showcase that. So with that, please enjoy the next 3 days. And as the CTB motto, I think goes, think big, start small, and learn fast. Have a good night, everyone. Thank you so much for your time.